Good afternoon, and welcome to today's Side by Side with the Division of Mental Health, Developmental Disabilities, and Substance Use Services, Improving Our System Together monthly webinar. Before we get started, here are a few reminders about the webinar technology. Please make sure you are using a computer or smartphone connected to the internet, and the audio function is on and the volume is turned up. Please be sure your microphone is muted for the duration of the call, unless you are speaking or asking questions. Questions can be submitted anytime during the presentation using the Q&A feature located on your control panel. We will answer as many questions as time allows after the presentation. American Sign Language interpreters and closed captioning options are available for today's event. The American Sign Language interpreters for today are Danette Steelman-Bridges and Susan King-Lanier. For closed captioning options, select the closed caption feature located on your dashboard. To adjust your video layout and screen view, select the view feature located in the top right-hand corner of your screen and choose the view that works best for you. Today's agenda topics include introductions and mental health, substance use, intellectual and developmental disabilities, and traumatic brain injury, system announcements, and updates. Our focus today is crisis services. We will also have a question and answer session following the presentation, if time allows. At this time, I'd like to turn it over to Kelly Crosby, Director of the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Hi, everyone. Thank you, Dina. Hi, my name is Kelly Crosby, and it's good of you to be here with us today. Thank you for joining us. I'm the Director of the Division of Mental Health, Developmental Disabilities, and Substance Use Services. Here's a little bit of information about me. If you don't know about me and I haven't met you yet, I'm glad you're here today. I've been in the field for a very long time. I've been close to 15 years now at the department, and I've been in this role as the division director for about 2.5 years. I'm a licensed clinical social worker, and I'm a person with lived experience, which is really important to all the work that we do here at the division. So today we have a lot of updates to walk you through, and we're going to talk about crisis services. And some of you may be thinking, wow, you guys talk about crisis services a lot. And I would remind you, it's because we are investing in a really robust mental health crisis system here in North Carolina. And that takes time and work, and we're in this for the long haul. So as we continue to make updates and improvements in the system, we want to keep updating you. I'm really excited about what we're going to share today. We have some new website features we're going to walk you through. We have some new content, including public service announcements that will be going out. And I bet you'll recognize some of the faces. So when we get closer to that part of the presentation, I'm going to get a shout out to the 4 provider agencies that actually participated and are featured in our public service announcements about the crisis system. All right, let's go on to the next slide. So I've got all kinds of system updates, and I'll be joined today, I think Dina mentioned, by both Brittany and Charles. And I'm very excited that they are here presenting with me today. Next slide, please. So June is really important. Last month was Mental Health Awareness Month, but I want to lift up some awareness celebrations this month. The first thing I want to lift up has actually passed on the next slide, is we did celebrate Memorial Day. And so I do want to thank all the veterans, the current service members, and their families. It is a day to honor you, and especially the sacrifices of people who have served in the military and have passed away serving us as a nation. So want to recognize and honor that. It's very important that we continue to focus on supporting our veterans, active service personnel, and their family members here with a variety of services and supports. And so on this slide are some resources, everything from 988 to NC for Vets. I'm going to talk about that more in another slide. NC Serves, I'll talk about that as well. But we've got a variety of services for veterans, and we're always looking for feedback on how to make those more robust and better. On the next slide, I wanted to highlight something that we sent out around Memorial Day. Well, first, it was actually published by our friends at ABCCM, who run the NC Serves program. The NC Serves program, if you don't know about it, is extraordinary. It's been around for 10 years. The Serves program actually started before we partnered with them, but we're a proud partner of NC Serves. NC Serves really is a care management and care navigation program for veterans, active military, and family members. And it's a wonderful report. It talks about 10 years of the program, the number of people who have been served by the program, when we've seen spikes and increases in service. And it also gives us really helpful information about where we still have needs, what the most common services and supports people are asking for in the community. Not surprisingly, mental health and substance use services are one of the top things requested in the NC Serves program. So I want to congratulate the NC Serves folks in the community, ABCCM, for their work in managing this program through the years. All the care coordinators who actually manage the program. We're proud of the work and proud to continue supporting this program for years to come. Next slide. Also, we just published last month the NC for Vets Journal. That's in partnership with the Governor's Institute for Substance Use Services. You know, they're a strong and important partner of us that help us with opioid and veterans programs. They help manage the Governor's Task Force for veterans, and which our own Renee Rader, you know, our deputy here at the division, she's a co-chair of that committee. And this journal is also done in partnership with the Triangle Business Journal. So another way that we're making sure that we are providing access and information to the broader North Carolina community and not just folks in our system. It's a really great publication. It talks about a lot of services and supports for veterans, of course, with a strong emphasis on mental health and substance use services. So take a look. I'm very proud of the journal. And again, plan on continuing to publish this year over year. There's some hot links. You can actually read stories and then visit the NC for Vets website. Lots of really great information. Next slide. June is Pride Month. So Pride Month is a time to recognize and celebrate the LGBTQIA+ community. Want to honor the incredible contributions of the community, but also want to offer support. There is really important for us to be mindful of and aware that individuals in the LGBTQ community often suffer higher incidences of mental health issues, substance use issues, stigma, issues with everything from community acceptance and bullying, and things that are incredibly traumatic and also really challenging. And so want to recognize that those really stigmatizing and harmful behaviors can really hurt our colleagues and our friends and our loved ones in the LGBTQIA+ community. On this slide, you'll see lots of statistics, but I want to take this moment, of course, to celebrate the community, but also to offer our support and to be really mindful, and we're being mindful every day of the ways we need to serve the unique needs of the LGBTQIA+ community. I'm going to tell you a little bit about those. Don't want to dwell on, you can look at this slide and think, whew, this is pretty heavy stuff. It is heavy stuff, but it should be a celebration of culture, but also a call to action. So I want to talk a little bit about what we are doing in this space here in June, all year round, excuse me, but we're highlighting it now because it is Pride Month. So on the next slide, as you recall, last year we used, and we intend to keep this up, our mental health block grants, one of our priorities in our strategic plan. Look at you see the little house and the increased access to care across the state. You'll see a lot of those kind of icons and priorities across the slides today, because much of what we're talking about are program updates that we've been working on that actually support initiatives in our strategic plan. So last year with our mental health grants, we provided a variety of access grants to different communities across the state because we want to make sure that we're reaching people with mental health supports in their communities, in spaces and places where they feel comfortable and more apt to receive care. So we were able to award multiple community-based agencies, but one of those were for these three organizations who are supporting the LGBTQIA+ community. And so the folks that we were able to support this year, and you'll see pictures of all of them here, are UCA Waves, the Charlotte Trans Health Path Program, and Quality Comprehensive Health Center. And really what these programs are, they are specific for the LGBTQIA+ and communities. They offer everything from counseling services to education and workforce development. They also offer things like care navigation and supports for for individuals, for families, for allies. So we really, again, these grants are about increasing access to care in ways and in places where people routinely receive care in communities where they are comfortable. We're really excited about these partnerships, and we're excited to tell you more about how these programs are progressing over the year. On the next slide, also want to remind folks that we also have the Trevor line. Hopefully folks are aware of the Trevor line. When you call 988, you can press a button to get transferred to the Trevor line. You can call, chat, or text, and that line, you don't have to, but that line is very specific to the LGBTQ community, youth in particular. So that line is available for youth who need special or additional support right through 98. And on this slide, which we're going to make sure get out to everyone, there are a variety of other resources and access lines available in North Carolina and across the nation. So again, we want to make sure that whoever needs services wherever is able to find them in ways that make sense and are comfortable to them. So this is additional supports for the community. Next slide. We also celebrate in June, Juneteenth, or Freedom Day. And this commemorates the emancipation of enslaved Black people in the United States. We're pausing on this, and we want to remember Juneteenth because health equity, mental health equity is the priority for us. So when we think about Juneteenth, of course, we're going to talk and absolutely celebrate the wonderful contributions of Black Americans, but also we'd be remiss if we didn't take a moment to say that we do not have mental health equity in many ways, but certainly individuals in Black and African American communities often have higher rates of needing care and also not receiving care. So again, one of our priorities here is access. It is making sure folks in all communities, and certainly Black North Carolinians, receive care in ways and in places and communities that make sense to them. So one of the things, I'm actually going to turn the microphone over to Brittany, and she's going to talk about an initiative that you may have seen in Hot Topics. It's incredibly important to us. It's very fitting and aligns with our theme on crisis today. But she is going to talk about the Black Youth Suicide Action Plan. It's incredibly important. She's going to tell you why we have this plan. She's going to tell you what we're trying to accomplish, who is involved. And with that, I'm turning things over to Brittany Jones, who is the lead for our crisis team here at DMHDDSUS. Over to you, Brittany.
Thank you, Kelly, and good afternoon, everybody. If we move on to the next slide, like Kelly said, I'll be talking about our Black Youth Suicide Prevention Action Plan. So you may have seen this go out in our previous Hot Topics communication, but DMH to DSUS is partnering with the Division of Public Health, UNC Suicide Prevention Institute, the Department of Public Instruction, and Village of Care to develop a strategic plan dedicated to preventing suicide among Black youth. This is the first of its kind strategic plan in the history of North Carolina DHHS and the division. And we invite you to give us your input to make this the strongest plan possible. Thus, we're seeking public comment on this draft plan. So after reading the plan, if you want to, give us feedback, we're accepting the feedback all through Friday of this week, June 6th. So links will go out on how to access that plan. Moving on to the next slide. So I wanted to provide you a little bit of background on the development of this plan and how this came about, as Kelly said. In the summer of 2024, SAMHSA invited the state of North Carolina to join 8 other states in DC and plus DC at their Black Youth Suicide Prevention Policy Academy. That was the second year that they had that program. So we answered the call, forming a cross-sector leadership team to spearhead this effort. We spent 3 days in Bethesda at the Policy Academy, learning from subject matter experts and developing the current state action plan to prevent suicide among Black youth in North Carolina. Next slide, please. So we named this plan initiative Stronger Together because we are truly stronger, uniting together to address the current state of suicide among Black youth. So this slide lists out the strategic overarching goals that are included in the Stronger Together plan. These include engaging in regular strategic planning, establishing a youth advisory board, hosting a conference with the focus on suicide prevention among Black youth, developing a community of practice in education, or as we call it, COPE, training non-clinical youth and adults on the crisis system and suicide prevention and evaluation efforts for continued improvement. We targeted 17 counties for this effort based on North Carolina's emergency department data and 988 data. Next slide, please. So here you'll see the map of the counties that we centered our focus on. The counties that have a star in them are the ones that we centered and focused using the data focused our efforts on. So based on the data that we received through 988 usage and emergency department, these had the highest utilization of emergency department utilization amongst youth, and then the lowest 988 engagement. So we tailored those to those counties. So next slide, please. So the North Carolina Black Youth Wellness Advisory Board, which I mentioned was a part of the planning for this Stronger Together project, has recently got up and running. So the application was released across the state in February of this year and was open to young adults ages 18 to 24. We received 129 applications from candidates across 32 counties. Currently, we have 94 active members and are thrilled to have such a diverse representation of young adults across the state. The members of the Youth Advisory Board are working in 13 subcommittees to give them a more targeted focus. Some examples of the focus include Black women's mental health, Black men's mental health, athlete mental health, military family mental health, and foster care / transitional youth health, mental health. So our overarching goal for the Youth Advisory Board is to give young adults a forum to effect change in policy and practice within the mental health and crisis system. We will train them on the crisis system and resources to equip them to support their peers, because we know peers is a big amongst the youth population. The young adults will also assist with conference planning and developing and executing their own initiatives in their subcommittees. We also hope that this work sparks a passion in the youth, and potentially some will go on to pursue a long-term career in the mental health field. Next slide, please. So again, another part of the Stronger Together plan was creating the community of practice. So we formed the community of practice that includes adult partners and advocates. Our goal with the community of practice is to bring together cross-sector advocates and championing to foster collaboration, share best practices, and collaboratively address solutions to decrease stigma by promoting, implementing culturally relevant crisis care and suicide prevention for Black youth. We currently have 134 active members who are participating in the community of practice. Like the Youth Advisory Board, the community of practice and education members will be sorted into 13 subcommittees and will have the same focus area that youth have. In the long term, we'll bring the youth and the adult subcommittees together for the cross-learning. Next slide, please. And lastly, and certainly not least, we'll be hosting a conference focused on the suicide prevention amongst Black youth, changing rhythms, new movement, adapting responses to Black youth mental health is the name of the conference. It will be hosted in September 20th at the Rocky Mount Event Center and will be targeted for youth ages 18 to 24. So we're in the early stages of planning. However, there are opportunities for organizations to table and to sponsor parts of this event. So if you're interested in these opportunities, or in staying in the loop about the event, you can email our state suicide prevention coordinator, Hannah Harms, at the email address on the slide, or you can reach out to me, and it'll be, the information will also be announced in our hot topics as well. And I will be turning it back over to you, Kelly.
Great. Thank you so much, Brittany. I really appreciate all of your work with the community. Thank you to Hannah. Really excited about all of that. And I think there'll be a hot topics coming soon. There was what was it? You sent it this morning. One of the papers featured one of the events that happened as part of the project.
Yeah, so they over the weekend there was a skate event at one of the skate parks here in Raleigh, focused on 988.
Very cool. Thank you so much, Brittany. All right. I'm going to turn now and do some Helene response updates. So on the next slide, just always want to keep Helene recovery in our minds. I want to give folks an update on the Hope for NC program. As a reminder, and some of us, when you turn our screens on, I have a Hope for NC banner, and some of us have the Zoom screensavers behind us. But we always want to remember that folks in Western North Carolina obviously need a variety of supports, but certainly need continued mental health supports. So we wanted to give you some statistics. Remember the Hope for NC program. It is a program of a hotline, crisis counselors, and those crisis counselors go to events. They're everywhere. We just like to show you pictures. They're out and about everywhere in the community. They wear branded shirts. They're able to provide brief counseling intervention after being trained, and they're able to link people to additional resources. And we know how crises work, right? A disaster happens, and it may, for some people, it may cause an immediate crisis, but for others, over time, symptoms and concerns begin to come up. And we want to make sure that the community is very aware that mental health resources are available, and we're here whenever you need us. 1000% credit to the teams at Real Crisis, who's operating the Hope for NC line, to VIA, who's hiring and overseeing teams, as well as Partners, who's hiring and overseeing teams. And also shout out to our team here at the state, who gets to the privilege of working every day with VIA, Real, and Partners. So our hotline calls continue to go up, as well as individual counseling events, public education, and we're contacting thousands of people. On the next slide, you'll also see our billboards are live. So thank you, Marla, for taking pictures of some of the billboards. So we've got 32 billboards out in 12 Western North Carolina counties. We will have public service announcements about Hope for NC going live in June. We'll have social media posts going live in June. And the whole point is we just want people to know we're here. There is help if you or your loved one or your friend or your colleague is experiencing emotional stress and needs some support. All right, next slide, please. Also want to give an update on some community events. Next slide. So again, in the vein of increasing access to care across the state, one of the partnerships we're really excited about is our partnership with the Triangle Business Journal. We mentioned that earlier today, that they help us produce the North Carolina for Vets Journal. They also, you have seen in Hot Topics, and we've talked about it here. We've already had 2 editions of our Mental Health in the Workplace Journal, and we were invited to a panel, the first for the Triangle Business Journal. They had an Empowered Women's Forum. It was so exciting. You see me sitting up there with Senator Adcock, and then Kate Stratton. We were having a talk about health care, like women's health in the workplace. The entire panel and all the questions were dominated by discussions around mental health and wellness. It's a really important topic, and it's very exciting that we continue to find avenues and opportunities to talk to the community at large about having comfort talking about mental health, how to prioritize your mental health and wellness, how to talk to colleagues, coworkers, your team who may be struggling and need mental health support. So it's another way that we are trying to connect with the broader community. On the next slide, you will also see that we participated in NAMI walks. I want to give a huge shout out to Holly and Lillian and the whole NAMI team. That's the statewide NAMI chapter, but huge shout out to all the chapters of NAMI and NAMI on campus across the state. We are a proud supporter of NAMI chapters as well as NAMI on campus chapters. We're proud supporters of NAMI at the state level, and we had a team at NAMI Walks. So just a wonderful and incredible event. It is continuing to raise awareness of mental health and mental illness across the state and across the nation. And it was just a day for celebration. So thank you to everyone. There were over 1,000 walkers. It was a great day. So thank you to the NAMI team for hosting such a great event. Next slide. Want to give a highlight of a few programs. Next slide. So again, in the vein of increasing access to care, as you know, one of the things that we manage here at the state is the North Carolina Problem Gambling Program. You've probably seen, if you're tapped in at all, well, I'm sure that you have seen advertisement for online sports betting everywhere, billboards and TV commercials and YouTube commercials and social media commercials. It is everywhere. And our wonderful team in partnership with ECU and other folks in the gaming industry are doing a lot to do everything from staffing the problem gambling hotline to, in particular, this is really important, working with young people in school, high school, and also in college. So we've had a variety of interventions aimed at supporting kids to be mindful, to emotionally regulate, to understand how gambling is gamified, and really help them be cognizant, aware, and really to build up their strength and resilience. And so we've been working with, or not we, but the awesome team here that manages the Problem Gambling Program, had a great event in Wake County. And I think we have a video just to show from it. So this is us celebrating. And also, please know, if you're interested in some of these trainings for your school in particular, let us know, please, or your Boys and Girls Club, or at your YMCA, because these trainings are incredibly powerful. And it really is about prevention and teaching people, especially young people, really good skills. So can we show that video?
Gambling is a bad business. Please don't do it.
You want to stop gambling? If so, call 1-877-718-5543 or visit morethanagamenc.com.
That was awesome. That young man said the tagline. I forgot to say that morethanagame.nc.gov. But these are kids really learning skills and creating their own PSAs. That's really cool. So great job, team. That's always heartwarming to see, but also it makes a huge difference. Okay, next slide, please. Alrighty. Also, another just programmatic announcement is we also released our NC Innovations Waiver Toolkit. And so just as a reminder, remember, almost every month we do an update on more of our accessible communications campaign, okay? Remember, we started with all kinds of presentations, flyers, one-pagers, PowerPoint presentations on here's what a tailored plan is, if you remember that. Since then, we have created content or co-created content with consumers and families on everything from the 1915 I option, so what those services are and how to get them. And our biggest launch to date has actually been around the Innovations Waiver. Why? Because there are still citizens here in North Carolina that have not heard of the Innovations Waiver. We know, unfortunately, that there is a long waiting list for innovation services. Therefore, we know that the sooner people know about services, the sooner they can get on the wait list. But also, these information specifically let people know that, yes, you will get on a waiting list. Here's what Innovations is. But it will also tell you about other services that may be available while you wait, like the 1915 I option services. So please look at the toolkits. There's all kinds of one-pagers, handouts, presentations that you can use wherever, in any community forum. If you're a provider, you can use them. You can hand them out. We have new waiver web pages. We have social content that you can use and you can post. And these are available in both English and Spanish. And typically this kit, like everything else, came with a link. If you look online, the link might still be there if it's still live, where if you send us information, we can actually print copies out for you. Because there are places we're really trying to get right into pediatric offices, into departments of social services. So there's places, again, where kids and families may go to hear about innovations. And we want to make sure that they're able to find out about services and get on the waiting list. It's really important that we increase access to services by actually getting the word out. Next slide. All right, there's a few conferences we want to highlight. It is conference season. This is our first Adolescent SUD conference. That is this week. It has a wonderful agenda. I'm on the agenda. That wasn't me saying, woo, come and hear me speak. I'm privileged to be there, and I love any opportunity to talk about what we're doing in the adolescent substance use space. My talk will be a lot about our strategic plan, our prevention priorities, our prevention outcomes, what some of the data is telling us about access to care, and things like our collegiate recovery programs, our prevention plan, our anti-stigma campaign, and what we're doing to get more substance use services out there for adolescents. So I'm just going to give a state update, but there's a lot of really fantastic speakers. In our strategic plan, substance use in youth, both prevention, but also treatment and recovery, it is a priority for us. We need more easy to find options for families and youth. Okay, so tune in, register. Next slide. We're also super, super, super excited that this month, you know, it is the I2I conference. You're all going. I2I is awesome and great. But we have the privilege this year of hosting a pre-conference day. And we are hosting a day on the Olmstead Plan. And you see on there a lot of the speakers, a lot of the faces that you know, they're very important in Olmstead. You see Ginger, you see Deb Goda, you see our friends at Medicaid, you see Kenneth. So this is very much a departmental priority for us. We'll be giving updates, but we'll also have consumers, people with lived experience giving updates, because Olmstead is a priority for us. Recovery is possible, community integration, and people living the life they want to is our priority. People need choice, and they need the supports they need to live a meaningful life in the community. So this pre-conference is just a moment to really double down on that, that vision, and also share where we are and where we're going with our Olmstead work here in North Carolina. And come to the IDOI conference. I, unfortunately, will be. I mean, it's not unfortunate, but it happens to be the week that we have our National Substance Use Conference, as well as our National Developmental Disability Conference, literally that same week. So I will be at both of those. And in both cases, highlighting some awesome North Carolina work. People want to know what we're doing in these spaces in North Carolina. So that's exciting. So I'm sorry I'll miss it, but look at that lineup of tremendous, incredible speakers. So please come. Next slide, please. All right. So now we're going to do some crisis updates. I'm going to do some updates. Charles Rousseau is going to also do some walkthroughs with you. He's going to tell you about communication materials. He's going to walk through some websites. And the ask is simple. It's simple, but it's hard. We are working on making the crisis system as robust and as strong as it can be. You know that we used a lot of funding from the General Assembly over the past year and through this year to create additional crisis capacity in the state, more urgent cares, more facility-based crisis beds for both children and adults, more peer respites, right? We want people to have a safe place to go when they are in crisis. This year, we'll also be working on mobile crisis teams. We want the teams to work well, people to know who to call. We want to be able to deploy them. We want co-responder models. So if people call 911, a social worker or mental health professional also goes out. So we're doing a lot to strengthen the crisis system, make it predictable, reliable. But what we're talking about today is something slightly different. It's advertising the crisis system. We've spent a lot of time understanding how people view the crisis system, how much they know about the crisis system. And what we saw was most people did not know about the mental health crisis system. And there were messages and themes that really resonated with people when they thought about themselves in crisis or a loved one in crisis. This was the kind of system they wanted to have. And so we have used that to work on a good marketing campaign, which may sound strange, but our goal is to strengthen the crisis system, but also to provide access. Remember, that's a big primary goal of ours, to provide access. And people can't use what they don't know doesn't exist. So let me talk about crisis systems. So back to my ask. My ask was, help us get the word out. Tell folks about the crisis system. You're all in social media, post the PSAs, use some of the content that we're going to give you. If you do a presentation, present on the crisis system, but always give us feedback. Give us feedback. So we have strong information. Give us feedback about what groups we're not reaching, how we can reach them better, what we can do to improve our crisis system. So remember, this is ongoing work for us. It's not a one and done. So let me give you some crisis system updates before I turn things over to Charles. All right. So the first thing, without a terrific amount of fanfare, we published our Peer Warmline dashboard. I'm going to show you a snapshot of it, right? This is an important part of our crisis system. It just is, right? You can call 988, you can call the Peer Warmline. We're kind of first in the nation around having a coordinated 988 and Peer Warmline system. Our Peer Warmline is very popular. I'll show you some data on that. It is staffed by certified peer specialists. They have lived experience. It's 24/7. We have a lot of callers. This launched in February of 2024. We've had over 56,000 callers, incredibly high satisfaction rates. 40% of people are calling back. And this is very much a peer-led, non-crisis in the sense of what 988 or 911 would do system. You can call for any reason. And Peer Warmline can get you the help that you need, the support that you need, or put you in contact if you need another level of support. Okay. On the next slide, I want to show you a static picture of the dashboard. This isn't a live dashboard, right? So if you look at it for a second, you will see that it looks a lot like the 988 dashboard. So on the left-hand column, we show you the call volume, how many people are calling every month. In the top middle, we say, what are callers calling about? This is important data for us. What are callers calling about? For many people, they just need emotional support. That's why they're calling. They're calling to talk to someone who knows what it's like to be in their shoes. They just don't feel well. It takes a lot to reach out, and they're looking for someone who will not judge them. They can be anonymous, and they can get whatever kind of emotional support they need. So that doesn't surprise us. That's the number one reason people are calling. How did folks hear about the Peer Warmline? I think what's a little stunning to me on this one is the top reason is through an internet search. So when Charles talks about some of the work we're doing on marketing, some of the things we have done, people that have skills that I don't have helped us to develop websites or key language in our own website. So when people Google things, they'll actually go to our crisis site, and the crisis site tells you all about 988 and the Peer Warmline and Community Crisis Center. So we're trying to help people who are looking for help find it. So I think it's fascinating that the number one reason people heard about the Peer Warmline is just through doing an internet search. In other places, other lines are sending them to the Peer Warmline, like 988 is sending people to the Peer Warmline. If you look in the bottom left-hand column, you will see that's a heat map. If you're not familiar with heat maps, the darker the county, the more people are calling, right? That's the higher volume of calls. So you can see very clearly there are certain counties in North Carolina where we get a lot of callers from. So part of, as we think about getting the word out, it is getting the word out to the other counties maybe where we're not getting a lot of people who are calling, who may not know about the line at all. So when we think about counties where there's maybe not a lot of uptake, we think about how we can market and get the word out. If you look at the callers by age group, that's the bottom thing on the middle. The number one age group of people calling right now is people 25 to 40, but that's followed by younger people who are 18 to 24. So those are the groups that are calling the most. And then we also track information on if someone called and they needed more supports, where are we referring them to? So yes, some people are being referred to maybe a formal treatment provider or service, but in many cases, people are just being referred for other types of support. And that could be a lot of things. Another support group, it could be NAMI, it could be a community-based organization. It could be lots of things. But again, this is really important information so we can understand who's who's calling the line, where we might need to advertise it more, and where we might need to invest additional resources in the community. The big takeaway though is we're glad people are calling the Pure Warm Line. We're glad we have it. We're grateful to the PRN team. And you will see us doing additional marketing for the Pure Warm Line. One of the new enhancements to our crisis page is advertising the Pure Warm Line. Next slide, please. So something we're doing also to strengthen our crisis system is I mentioned that we're building more BHACs, urgent cares, opening more facility-based crisis beds in partnership with the community. But we're also helping existing facilities to improve their physical space as needed. So some of our crisis facilities might be in older buildings or they haven't had money for equipment upgrades. So again, we want the crisis centers to be warm and welcoming places. We want them to be well advertised, well lit, clean, comfortable with modern equipment. And so we're giving grants to our current crisis facilities so they're able to improve the environment of care space for people that are coming there for care. We're very excited about this. Next slide. So did I miss some? Can we go back? Yes. Just want to remind folks about the town halls we have been doing. These town halls are advertised to all North Carolinians. And I think someone will probably correct me in the chat, which is fine. We have had across the town halls, we've had 2 cafecitos. I think we've had 3 English town halls. This is advertising one that had Lisa, Noah, and Natasha. We always have community partners who can actually explain what happens when you call 988 or explain what happens when you go to an urgent care. They're pretty cool. We've reached at least 30 to 40,000 people through these. This is extraordinary. These are people who don't typically understand or use our system. So we're reaching them and helping them understand that the crisis system exists. You can watch the replay. They're pretty cool. They're on Facebook Live. Next slide, please. And so now you're seeing new slides. These are the new slides we have developed after tons of focus groups with the community. So we understood how people are viewing crisis, what it is that they're actually looking for. And through that, we have developed, I mentioned social media content, one-pagers, slides. You're going to see some of those slides today, but also the public service announcements. And I want to call out some of our special friends. So in our public service announcements, we have the following agencies represented. You'll see staff. Some of you might be on the call today. So Integrated Family Services, you just saw Natasha, so some of her team will be there. Daymark Recovery Services, the Hope Center for Youth and Family, and Phoenix Recovery Support Services. So I want to thank them. We had folks who have mobile crisis teams, urgent cares, and facility-based crisis develop public service announcements for us, and they're really cool. So we're going to show this to you today. Next slide. So this is some of the this gentleman. Hopefully you guys, some of you may recognize him. You're going to see his PSA in a moment. He works at, I believe, Integrated Family Services. I think I'm getting that right. And this is a slide that we developed. No matter the crisis, there are options. And we let people know you define a crisis. You can come and get support for any of these things because these were the things that our community told us they needed help with. So on the next slide, I think we're going to watch the first PSA, I think. Yep.
When life feels overwhelming, knowing where to turn can make all the difference.
That's why crisis services are here for anyone at any time, no judgment.
If you or someone you love is struggling with mental health, substance use, or feeling lost,
crisis services are here for you 24/7.
Compassionate, low or no cost services.
Whatever your crisis, you always have options. Find the support that's right for you.
Visit ncdhhs.gov/crisis services.
All right, thank you. Thank you to all of those community members who participated. This is just another slide. Again, that's a real operator. Also at Integrated Family, I met her, she's awesome. answering the phones every day when people call for crisis services, for mobile crisis services. So on the next slide, I think we have another PSA. Oh, not yet. This is another slide. One of the things we do on the Facebook Live, and you'll see on the websites when Charles walks through them, we try to first just sort of say, whatever the crisis is, here's some examples. You call, there is help. Here's the easy way to get it. Then we have slides that walk through 988, the peer warm line, which is this slide. Next slide. Then we also have more PSAs, so we're gonna stop here.
Crisis Services helped me get back on track. They listened without judgment and made sure I had the support that I needed.
No matter what you're going through, there's someone who will listen. I wasn't alone, and neither are you.
Whatever your crisis, you have options.
Reaching out for help was the best decision I ever made. You can too.
It's okay to need support. No matter your crisis, you have options. Visit ncdhhs.gov/crisis services.
Thank you. Next slide. Then we have slides that talk about what mobile crisis teams are. Okay, this describes them. Next slide. Another PSA that will talk about what mobile crisis is.
Mobile crisis units are teams that are designed to provide care for mental health and substance use disorders in the community. Our teams go to you, the person in the community, wherever you are, to provide treatment.
An individual calls our call center, and then they will, in turn, that call center specialist will dispatch that call to a mobile crisis professional. I pull up and that individual's sitting at a picnic table, for example, and I just walk over and sit down and begin to talk with them about what's going on today in their life.
Everyone goes through something, and you always need a soft place to land, and we hope that we can be that for anyone who calls us.
Contact the mobile crisis team that's in your community. Talk with the call center specialist. Ask them to tell you a little bit about their services, their team. You don't have to go through these things alone.
Visit ncdhhs.gov/crisis services.
So that was one of the mobile crisis PSAs. And then we talk about community crisis centers. We're trying to make sure it's a name that people understand, and those could be urgent cares or BHECs, or they can be facility-based crisis. And sometimes those names confuse people, so we call them community crisis centers frequently. On the next slide, we wanted to have a PSA, public service announcement that talks about what it is actually like when you go to one of those. So if we could play these or one of these.
For the behavioral health urgent care, what we do is we help clients in need and get connected to resources to get help with mental health, substance use, case management services.
Anybody can come in 24/7 to get an assessment completed. The first step is the hardest step. But once you get in, we'll make sure that we walk you through the process and explain things clearly so that you feel more comfortable with coming in and getting the right services.
Behavioral health urgent care is where you go when you have an emergent or urgent need, the same as you would take a broken arm to the emergency room, except you're coming to us because you aren't feeling emotionally well.
I think we offer comfort. Having a sounding board, having somebody who understands and can empathize with what they are going through.
A non-judgmental space and accepting space for people to be able to say, hey, I'm okay with having these difficulties.
To learn more, visit ncdhhs.gov/crisis services.
So I'm going to know that there's another link in here so you can see the facility-based crisis one, but we're short on time and I want Charles to have time to go through his website walkthroughs for you all, okay? Just another slide on community crisis centers and how you can utilize them. Next slide. Again, here's some wonderful slides that feature consumers, but we have to go quicker, I think, unfortunately. Yes, but there's a link in here for all the PSAs. But again, the PSAs are going out, so they will be out on social media. We want to get the word out. When people Google crisis, we want one of those videos to come up so people feel like it's okay to ask for help, feel like they know where to go or who they can call, and maybe help with some of the anxiety that people may have sometimes when they think about going some places. These are warm and accepting and thoughtful places to help you or a loved one or a friend who has a crisis. Next slide, please. So what Charles is going to do actually is walk you through. We have spent a lot of time working on our crisis website. Remember, a lot of Google searches now will actually pop up our website. So it's actually like top when people are looking for services. And we try to help people find a way to find the nearest mobile crisis team or community crisis center. So Charles is actually going to walk you through how the website works.
Thank you so much, Kelly. And what a pleasure to watch those PSAs, see real facilities with real caregivers. I feel really excited about that. Hello, folks. My name is Charles Rousseau. I am the Director of External Affairs for the Division of Mental Health, Developmental Disabilities, and Substance Use Services. And it's my pleasure to talk about some new features on our website so that you can find care when you need it most. So if we could click the link in the slide. Excellent. Thank you so much. This is our crisis services homepage, and we're going to put the link in the chat. I recommend bookmarking it. We've done a lot of thinking about this site. We've been in a lot of conversations with consumers and families to think about the best way to get people information that they can use. And the main message here is that help is available. You can get help 24/7. You are not alone. There is help when you need it most. And so let's scroll down just a little bit, if you would. As Kelly mentioned, you can connect with someone right now, either through 988, which has the option to call by phone, to text, or to chat online. You can get help right now with the North Carolina Peer Warm Line by calling the Peer Warm Line. Both of those are 24/7. Both of those are confidential. Both of those are free. And they're great options to connect with someone right now if you're having a hard time. We're going to scroll down a little bit more and talk about other options where you can get help in person. And so this is our mobile crisis teams and our community crisis centers. We will start with the mobile crisis teams. If you could click on that, please. Thank you. And so this page explains in a very simple way what a mobile crisis team is. It's one or two trained, caring counselors who will come to you when you need it most. They will meet you at school, at your home, someplace safe where you can get help and support. But how do you find a mobile crisis team? Where do they exist? We've built this tool to help answer that question and make it easy for you to find a mobile crisis team in your area. And these services are free. So this chart is organized by county in alphabetical order, but it has a really good search function. And so if you could go to the search function, I'm just going to put in a zip code that I know pretty well, 27707. And here are my options for mobile crisis team providers. That's the phone number. All I have to do is call one of those phone numbers. If I want to do research, learn a little bit more about it, you can click the link to see the providers page themselves. But this is a really simple tool so that you can find a mobile crisis team when you need it most so that help can come to you. Let's X out of that search box and scroll up a little bit. And let's go back to the home page, if you would. Thank you. And continue scrolling down. We're going to look at the community crisis centers now. So this is another option for getting help in person. And we have a brief description of what community crisis centers are. As Kelly mentioned earlier, there are two types. One is called a behavioral health urgent care. It's like the urgent care you might go to on the weekend if you fell on your bike and you were afraid maybe you broke a bone, but your doctor's office wasn't open, you didn't really need to go to the emergency department, you would go to the urgent care. We have the same thing for mental health and substance use concerns. You can go to a behavioral health urgent care. So keep scrolling if you would. There is a searchable map, and similar to the other search function, you can put your zip code right in that search box, and it will show you the facilities in your area. Let's do that same zip code that I know, 27707. Here are my options for community crisis centers near me. If I want to filter between a behavioral health urgent care and a facility-based crisis center, which usually provides longer-term care, there are options to filter the results so that you just find the exact kind of facility you're looking for. But the easiest way is just to type in your zip code, find what's near you, and make a phone call. We really like this feature. We think it is intuitive. And if you want to just have a list of all these facilities across the state, maybe it's something you just want to have a physical copy of that you can take with you. If you scroll down a little bit, you can download a list. There's a link right there of all these community crisis centers and their locations and their contact information. And I think this page does a good job making a distinction between what a behavioral health urgent care is, what a facility-based crisis center is, and giving you the information you need to know if you have questions about insurance. But you don't need an appointment to go to one of these facilities. Most of them are open 24/7, just like they say in the PSAs we just watched. And you do not need insurance to go to these facilities. If you have insurance, great. If not, most of these can offer no cost or low cost care. So we hope that cost will not be a concern for people. If you need help, there are safe places to go when you need it most. If you would go back to the slide deck, Brianna, I think that's probably as much as I have a little bit more that I do need to do. So if you could go back to the slide deck. We've got our PowerPoint driver. You're doing excellent work today. We're going a lot of different places with this side by side. So these are some of the communication resources we've created. Next slide, please. And as Kelly said, we're really excited about these. And our call to action, our request from you is to help us spread the word. These resources have been developed in consultation with consumers and providers and community partners of many kinds. We've done a lot of user testing to find the simplest language to be stigma-free in how we communicate. And we've made them all in English and Spanish. That's true on the website as well. You can do a Spanish version of the website. There's a link if you need that information in Spanish. So please, you can find this on our website, download the communication toolkit. You'll get social media posts, the graphics you can put on your account. You'll get one-pager flyers. You'll get access to our PSA videos that you can share with people. We really believe that if people know about these services, it's going to change lives and it's going to save lives. And so returning to where Kelly started, we really want to raise awareness because there are options. No matter what crisis you may be in, you have options. Thank you very much. I will pass the, here's our call to action, help spread the word. You can download all this stuff from our website. And I am going to pass it over to Kelly for any closing words. And thank you all so much for being with us.
Yeah, thank you so much, Charles, for walking through the website and walking through some of the materials. And thank you for everyone who helped us develop this. As always, you can send us questions. There were a few questions we didn't get to answer today. And probably the most important one that I want to mention is just folks continue to wonder about the state of state funding and federal funding for our mental health, substance use, IDD, and TBI system. Don't have any big updates for you, I am afraid. We know that our House and Senate here in North Carolina are negotiating the budget, and it will take some time. We always hope for a budget by July, but if not, hopefully we'll just get it when we get it, and we'll continue with the current budget until a new budget is passed. There were some cuts to our state funding, as well as we didn't see any additions for things like innovations or TBI waiver slots, but please continue your advocacy. There's still a lot of time as the budgets are being negotiated. We've not heard any additional information at the federal level. Our federal funding for our major grants, our mental health block grant, our substance use prevention, treatment, and recovery services block grant, our ACL grant, which funds some TBI work, our SOAR grant, which is the state opioid recovery grant, those grants continue and the money continues to come in for those. Always know that should that be disrupted or changed, we will let you know. We'll be as transparent and open and as swift to act as we can. You'll see those things in Hot Topics. We will be creative. We'll communicate with you and we'll work with you to make sure that as much as possible, our vital services aren't disrupted. But again, as we get information, we'll share it here, but nothing new to report so far this month. So thank you all for joining us. I'm going to turn things back over to Dina, who's going to wrap us up.
Thank you, Kelly. If we did not get an opportunity to answer your question during the webinar, questions and feedback are always welcome at bhidd.helpcenter@dhhs.nc.gov. The recording and presentation slides for today's event will be posted on our Community Engagement and Training webpage. The links are included in the chat box. There will be a brief survey following today's webinar, and we'd appreciate your time completing it. Our next side-by-side webinar is scheduled for Monday, July 14th from 2 to 3 o'clock, and we look forward to seeing you then. This concludes our webinar for today. Thank you for attending.